All right. Good morning, everyone, and welcome to Chicago Family Health Center. I'm Sherry Pace, CEO of Chicago Family, and I'm excited to share some of our history and highlights with you and our esteemed guests today. Chicago Family Health Center has been a fixture in this community for 45 years, offering high-quality primary care, dental, behavioral health, and other enabling services to meet the needs of the most vulnerable in our community on the south side of Chicago. We are currently serving over 29,000 patients annually, regardless of their ability to pay. The COVID crisis has proven that the services that community health centers provide are invaluable to our communities, as we were one of the first in the area to set up COVID testing and vaccination sites with over 23,000 tests performed and 12,000 COVID vaccinations given to date. This morning, I'd like to extend our appreciation to the Governor for his unwavering support of community health centers, as Chicago Family Health Center continues to provide access to health care for women, children, and families on the south side of Chicago. It's my privilege to welcome Governor Pritzker to the podium.
Thank you.
Thank you.
Well, good morning to everyone, and thank you so much to Sherry Pace and to her staff for all the amazing work that they do here. It's really an honor to be here at Chicago Family Health Center, and honestly, so many people are served here. It does not matter what their income level is. You can get health care right here at the Chicago Family Health Center, and it's important for our communities to have community health available to everyone. I think health care should be a right and not a privilege. I think it should be available to everyone, and we're trying very hard to expand it to everyone in the state of Illinois. I've said it before, and I'll say it again. Abortion is health care. In Illinois, we trust women to make their own decisions about their bodies. And since the Supreme Court overturned Roe v. Wade, our reproductive health providers have been working overtime to ensure that every patient has access to the reproductive care that they're entitled to. So starting September 1st, we are increasing Medicaid reimbursement rates for abortion services by 20% to help them cover the costs of providing these vital health care services. No matter how terrible other states treat women and their bodily autonomy, as long as I'm governor of Illinois, we will continue to protect and support reproductive health providers and safeguard reproductive freedoms. We're also eliminating bureaucratic billing hurdles for abortion services for those covered by both Medicare and Medicaid so that we can get payments moving to providers sooner. The Illinois Department of Public Health is also expanding our Illinois Family Planning Program with an additional $2 million in grants for providers offering family planning services, bringing the total Title X budget to over $13 million. This additional investment means more Illinoisans will receive quality, accessible family planning services like pregnancy testing, basic fertility services, STD tests, and cancer screenings. Thank you to DHFS and IDPH for their leadership as we navigate a post-Roe nation. Over the past 2.5 years, we've all seen firsthand the critical role that IDPH plays in keeping our communities safe and healthy. Illinois was the first state to run our own tests for the COVID-19 virus. Former Director Dr. Ngozi Ezike was one of the first experts that Congress called upon so that they could learn more about how our COVID response on the ground was going in the early weeks of 2020. And when the time came, IDPH spearheaded our vaccine rollout with their partners at the Illinois Emergency Management Agency, administering doses to nearly 9 million Illinoisans, making Illinois one of the most vaccinated states in the nation. Every step of the way, IDPH led with health equity, protecting our most vulnerable as COVID-19 magnified the inequities in our healthcare system. Now we're taking that same collaborative and inclusive approach to address the ongoing outbreak of the monkeypox virus in Illinois. And you have to remember that IDPH does so much more than respond to public health emergencies like COVID-19 and monkeypox. The agency encompasses more than 200 programs ranging from reproductive health care to food quality and from dairy farms to shots in arms. The spotlight might not shine on them as much as it did over the last 2 years, but every day the thousands of workers who shape this heroic agency continue their efforts to make Illinois a safer, healthier, and more equitable state to call home. And today I am very proud to introduce to all of you IDPH's next visionary leader, Dr. Samir Vora. Dr. Vora is highly accomplished in every sense of the word. His experience and education transcend sectors and fields, bringing a well-rounded perspective to this agency. As a general pediatrician and an associate professor of pediatrics, public health, medical humanities, and law, Dr. Vora is laser-focused on our most vulnerable populations, especially our youth. And Dr. Vora has been nationally recognized for his dedication to this work. He is well established as a leader in state and national policy formation, currently serving as the president-elect of the Population Health Leaders in Academic Medicine and as the interim chair of the Children's Mental Health Partnership right here in Illinois. He recently completed his term on the Illinois COVID-19 Response Fund Steering Committee, helping to disperse funds to nonprofit organizations throughout the state of Illinois, providing essential resources to our most impacted residents. To say he is a committed public servant would be an understatement. And I truly have absolute confidence in Dr. Vora's ability to continue shaping a stronger IDPH for the 21st century. Speaking of service, for the past few months, Amal Tokars has served as interim director of IDPH for the last 5 months. Throughout the pandemic, she has served as an instrumental member of the agency's senior leadership, as she did before, and she will return to her role as assistant director to continue the important work that she does on public outreach with our regional health officers. I want to thank her for her excellent and dedicated service to our state in this amazingly crucial time. With that, it is my pleasure to introduce Dr. Omar Latif, the President and CEO of Rush University System for Health. Dr. Latif.
Thank you, Governor Pritzker, for that warm introduction. It really is an honor to be at the Chicago Family Health Center and to speak on behalf of Rush at an important time like this. Healthcare is at a crossroads. COVID changed everything. It changed the way we see patients to how we treat them and where. It changed the needs that patients have, and it increased the responsibility of healthcare all over this world. Healthcare providers had to be nimble, creating new ways of caring for patients and collaborating across schisms that we've never collaborated with before. The Illinois Department of Public Health was the catalyst, ensuring that organizations like Rush, the Chicago Family Health Center, and other key partners came together to meet Illinois' most pressing needs. And that coming together saved thousands of lives in this state. Change and challenge will always be constants. Whether it's the new COVID variant surfacing in some states, limiting access to care of viruses like monkeypox coming into focus, it's important that we all stay nimble and work closely together to face whatever challenges continue to come our way. That takes visionary thinkers like Dr. Samir Vora, who are leading the IDPH, and Governor Pritzker, who's protecting the health of people of Illinois. No matter what global, environmental, or legal pressures that affect health care, one thing will always remain the same. Meeting the needs of patients and citizens across Illinois has to be our priority. To provide every patient with excellent health care they deserve in a safe, compassionate, confidential setting, regardless of their age, gender, who they love, or where they live. I would love to spend some time sharing the accomplishments of Dr. Vora, but I don't have more than 2 minutes. I actually would need about 2 hours. Actions speak louder than words, and Dr. Vora's accomplishments are stunning thus far in life. His achievements, his impact have been out of proportion to what he's done, and we're very excited for the opportunity to collectively work with him. Rush looks forward to working with all of you together and continuing to show the nation how health care should put the needs of all patients first. Thank you.
Well, hello, everybody. Thank you, Dr. Latif, and thank you, Governor. And thank you, Ms. Pace. I'm humbled by that introduction and your trust in me to serve the state of Illinois as the 20th Director of the Illinois Department of Public Health. It is my great honor to be here at the Chicago Family Health Center, standing before my family, the providers on the ground serving our community, and the people of Illinois. Illinois has always been my home. Born in Chicago and raised in its suburbs, I have had the wonderful opportunity to study and live all across the land of Lincoln. I started my career on the south side of Chicago, learning to be a pediatrician dedicated to caring for children and families. Those early years at the University of Chicago taught me how much of what affected the health of our families stood beyond the walls of the clinic and hospital. Many of my patients, especially those in the poorest Black and brown communities, simply struggled without the right foundation to be healthy. As a practicing pediatrician, teacher, and later the founding chair of the Department of Population Science and Policy at Southern Illinois University School of Medicine, my focus shifted to better understanding and improving the health of rural communities. Although the challenges of the city that I was born and first practiced never left my mind. Similar to those in the city of Chicago, our Illinois rural residents struggled with the disadvantage and disparity, affected by deserts of services and a disconnection between programs. For me, the role and responsibility of public health starts with one overarching and all-encompassing goal: to prevent and protect the public from disease and injury. Yet we are living in a moment where it is just hard to feel protected. We are 2.5 years since the start of the COVID-19 pandemic, and although we are learning to live with the virus, my heart continues to mourn and grieve for the families of the 34,388 Illinoisans we have lost to this terrible disease. Beyond other emerging illnesses like monkeypox, we are challenged with an epidemic of gun violence, a mental health crisis, and a growing national threat to the protection of reproductive rights. It's impossible not to feel the weight of these challenges, but under my leadership, the Department of Public Health will serve the people of Illinois as your resource and as your guide, providing critical information and offering services for individuals and families that will help them lead the healthiest and most productive lives. We are fortunate to live in a great state with strong leadership dedicated to working for all Illinoisans. Governor Pritzker and his administration, along with the dedicated staff, many of whom are joining me today, many of the staff at the Department of Public Health have served our state with great purpose. Dr. Ngazi Ezike and recently Dr. Amal Tokar's leadership and communication have inspired us all in the public health community. I want to build on their accomplishments by emphasizing the scientific process, evidence-based decision-making, and a focus on health equity. COVID-19 continues to teach us many things, but the most important lesson is that a virus that should have infected and harmed all Illinoisans in a similar manner did not. The reasons for this had little to do with the virus, and much more to do with the social and structural determinants of health, disinformation, and a rejection of scientific evidence. Although these revelations have demonstrated many challenges and barriers, they have inspired many of us to do more. That's why investments in public health, like the $2 million expansion in Title X funds that the governor just announced, are so important. 80% of those served with these Title X funded services in our state live below the federal poverty line. These are people who deserve the same access to family planning care as anyone else, and who are often the most in need of healthcare services. The governor has assembled an incredible team of health leaders focused on addressing disparities, and I have had the great pleasure of working with so many of them over the past few years. The leaders see a present and a future where Illinois is focused on acquiring the data and stories to truly understand the root causes of poor health, working with and for communities to design the right solutions, and using the right funding policies and strategies to effectively implement and sustain those programs. Ensuring public health requires a partnership with individuals, families, and communities across Illinois, and I look forward to collaborating with other state agencies, Governor Pritzker's office, and the General Assembly. I will carry on the Department of Public Health's mission to be an advocate and partner with the people of Illinois to re-envision health policy and promote health equity, prevent and protect against disease and injury, and prepare for health emergencies. My American journey is an immigrant story. Nearly 45 years ago, my father left his rural village in India to find a better and healthier life for himself and his future family in the United States of America. Chicago welcomed him, and it became our home. The city allowed my mother and father, Indian by ethnicity and Muslim by faith, to raise their children to follow their American dreams. Today, I am so fortunate to live in Springfield, be married to my best friend, love of my life, and the rock that makes all my and our family successes transpire, and raise our two young, talented daughters to follow in their own American dreams. Illinois has made all this possible, and I love our state and its people. I'm excited and honored to work with you, Governor, and serve the people of Illinois as the Director of the Illinois Department of Public Health. Thank you so much. And I will hand it back to the Governor to answer questions.
Thank you. Well done. Thank you. I'm happy to, sorry, let me take my mask off here. Happy to take any questions from members of the media.
Could we hear from both of you? Any updates on monkeypox? Where does Illinois stand? What about the vaccine?
All right, we're going to put Dr. Vora right on the spot the first day. Dr. Vora.
Well, our team at IDPH is really hard at work, and the disaster declaration that was sent through by the governor on Monday really allows IDPH to work with other agencies to really make government processes efficient to prevent the increasing spread of monkeypox virus. Now, the disaster declaration, we know that at the moment, monkeypox is still low risk to the general population. But this disaster declaration allows us to do many things, but important things like making sure that we have additional support that IDPH needs to really help prioritize and get vaccines out, expedite procurement to allow us to transport vaccines across the state, as well as lab specimens, and really sort of enhance communication abilities. And so the IDPH team is working very hard to make sure that the spread of monkeypox continues to be slow and contained. So the vaccine comes from a strategic national stockpile from the federal government. And our team is working with our federal government to get as much vaccine as can be allotted. But a lot of our work at the moment is really making sure that we transport that vaccine to the places that need it so we can contain and mitigate that spread.
Can you tell us how much more the state is trying to get, and are there concerns about vaccination cards? And also, if you can say, who's going to prioritize vaccines for, if they're limited?
So, we are doing our best. Every state has a limited supply, and we are working with the federal government to get as many doses as possible from the strategic national stockpile. We are prioritizing groups that are most at risk for having and getting monkeypox. Those that have had contact with somebody in the last 2 weeks with monkeypox, somebody who has had intimate sexual contact with somebody with monkeypox, and those that have had multiple partners in an area where there is a lot of monkeypox spread. And those are criteria that we're following from the Centers for Disease Control Prevention to making sure that monkeypox virus is contained, and also prioritizing those individuals, lab workers, and other individuals who transport and work with the specimen of monkeypox virus.
Dr. Vora, I know you give advice and counsel to the governor and to superintendents throughout the state. School's going to be starting in a few weeks, and I was wondering what the plan is for schools when it comes to masking and quarantining. And also, we know that LA Unified School District is no longer quarantining unvaccinated healthy children.
Well, we're working with our state partners at the Illinois State Board of Education to really make sure that we're creating an environment where people can go back to school and be as healthy as possible. And so I think those conversations are coming for us at IDPH to make sure that people have the right kind of testing and the material available to be as healthy as possible.
Doctor, I wonder how you prepare for a job like this when you saw how often we all heard from Dr. Zeke. Did that give you pause, or did that say, okay?
Well, you know, I would say that Dr. Ezike and then Dr. Tokar is, like I said, they were an inspiration to all of us. And her dedication and caring was something that I think made me want to be part in serving our residents. But I think we're all better off if I'm not with you all every day. It means that we're doing well. And so I'm happy to be here as much as the governor and the general public needs me, but hopefully you don't see me every day.
Yeah.
There was a change in vaccines that were required for college students.
Huh.
Many universities will say they're going to keep those policies.
Yes.
Brings some to question, now that you're running for re-election, is that the difference in why you said, okay, no more vaccines in colleges?
Well, there are many private institutions, public institutions, not just institutions of higher learning, but businesses also that are making decisions about how they want to bring people back, under what conditions, what requirements they'll put in. And because we are so well vaccinated across a strong majority of the population of Illinois, those choices now are things that we can, make sure that businesses and higher education can make for themselves and know what their conditions are on the ground locally, because we don't have widespread transmission and quick transmission of COVID everywhere in the state, because so many people are vaccinated. Not to mention, as you saw, I'm vaccinated, I boosted, and I got COVID and was able to recover within a relatively short period of time because I had been vaccinated and boosted. I'm focused on my own election. That's what I was saying earlier, and we'll all make decisions after that. Well, let's get past November. There's a February election you're trying to project toward, and I'm focused on my own. No, I know you'd like me to say something. Look, just because I haven't talked about endorsements in future elections does not mean that there isn't a possibility of it. Yes.
There's 102 county states attorneys who oppose the Safety Act, and there's bipartisan opposition in Springfield. I'm sure you're aware of it. One Bill County State's Attorney, James Glasgow, publicly said that no cash bail and detention limitations will, quote, empty out his jail, put 64 murderers on the street. So is Glasgow wrong?
Look, I think you understand that the Safety Act does many things that are very supportive of local law enforcement. We're providing funding, we're providing cameras, we're making sure that local law enforcement have the resources that they need, and indeed, to go along with that, because I know you'd like to isolate and just talk about that one thing, we're also building crime labs in the state. We've hired many, many forensic scientists so that we can allow police officers and police departments to have the tools and the technology that they need to solve crimes quickly. And so collectively, we are doing the right thing in order to bring more public safety to the people of Illinois. We're providing the resources that local police need, and I have significantly increased the number of state police to support them.
The question was about cash bail, and there is talk about cash bail perhaps being tweaked in some way.
Yeah.
So that those with serious offenses are not out on the street. And I add to that, besides the question, would you talk about cash bail, as well as, are you concerned about Chief Fox's leadership when more than one-third of our office has quit in the last year?
So, focusing on the first part of your question first. Look, what we don't want is for someone who is in jail because they've been arrested for a low-level offense, perhaps, for example, shoplifting, to be held in jail for months, maybe even years, because they don't have $200 or $300 to put up for bail. I think we can all agree that that is not fair. And at the same time, someone who is a wealthy drug dealer that has perhaps committed murder or been accused of it and arrested can show up with a suitcase full of money and get out of jail because they have the money for bail. I think we all agree that that is unfair and inequitable. And so certainly this is what the purpose in the first place of the provision in the Safety Act is about, allowing judges to make the judgment that someone who is poor and has committed a low-level offense shouldn't have to put up the couple of $100 that they don't have, and because they don't have it, sit in jail for months and months. Oh, sorry, yeah, happy to say. So let's start with being an assistant state's attorney in Cook County is a very, very tough job. It has been for many years. And I know there is burnout even before COVID. Now add COVID on top of it. So it's challenging to keep people, as we've seen in other industries too, but specifically as an assistant state's attorney. If there's a challenge with retention, that's something that needs to be addressed. Yeah. Thank you.